Alrighty. Hello, everyone. Hopefully, my volume is working pretty well. I would like to thank everyone for joining us tonight. Today is Wednesday, March 15th at 7:30 p.m. And we have another exciting iteration in the Brain Health at Every Age, Brain Awareness Week 2023. I am Dr. Will McBride, and I am here on behalf of the Society for Black Neuropsychology. And so we're very excited to bring you another topic that we have for you today. So we started out on Monday with prenatal brain health with Dr. Courtney Ray. She is the past president of the Society for Black Neuropsychology. Tuesday, we had brain health in older adults with Dr. Yinka Reed, which was a great talk. And tonight we're going to have a topic on brain health in kids with Dr. Sakina Butt. And so we are very excited for you all to join us. The Society for Black Neuropsychology is a 501c3 nonprofit organization that is dedicated to advancing the field of neuropsychology as it relates to Black and Brown individuals. And so we're all about advancing the knowledge for Black communities. And Brain Health Week is one of those times where we absolutely want to be able to provide important information and awareness and education around what do we need to do for brain health. And so we're very excited to have you with us. Please be, uh, put your questions or comments in the chat. If you're watching on YouTube, if you're watching through Facebook, we're so happy to have you join us. If there are any questions, just please feel free to put them in and we'll try to get to them at the end of the talk. But we're so very excited for you all to have us here today. I'm going to add Dr. Sakina Butts to the stream now. And she is going to be doing her introduction and telling you a little bit about herself and the exciting work that she does. Okay. Alrighty. So let's make this a little better. So Dr. Sakina Butts is going to be introducing herself. We're so excited to have her here, and I'm going to let you take it away.
Okay, thank you so much. I am, oh, there they are. Okay. I hope everyone can see the slides. There they are. Okay, so I think that's exactly what we want to see. As Dr. McBride said, I am Dr. Sakina Butt. I am a board certified clinical neuropsychologist and board certified pediatric subspecialist in working with children. And I particularly work with very young kids. And so it's fitting that I'm going to be talking about brain health and kids this evening. I really love what I do every day, and we're going to talk about how the work that I've done is highlighted in really emphasizing our awareness of brain health and how we can work to promote that at all levels. So to start, aside from being a pediatric neuropsychologist, I think it's important to know that when you work with kids, people work with all different ages. So as if you were able to join our talk on Monday, Dr. Courtney Ray talked about she's lifespan. So she works with individuals at all ages of the spectrum. And for me, in the beginning of my career, I started working mainly with what we say is school age children. So these are children who are between 8 to around 12 or 13. And I noticed that over time, my patients got younger and younger to the point where I was getting 2-year-olds who were frequently coming to see me. And so being able to see growth and development from all ages of the spectrum in terms of childhood has really helped inform my understanding of brain health, but also inform my passion. I'm also privileged to have a large family, and I'm an aunt to 10, and I'm surrounded by children all over my personal life. So I've had the privilege of watching these children grow and mature, and that also has inspired a passion in me to do what I do, which is to promote brain health in all kids. So tonight, we are going to talk about a couple of things. I want to recenter us in our understanding of what is brain health. So we've talked a lot about brain health, but for those of you who are just coming into the week, or those of you who may still have not a deep understanding of what we mean when we say brain health, hopefully the beginning part of this talk will help kind of keep us all on the same page in terms of what we're thinking about. I do want to spend some time talking about what does this have to do with kids, because most of the time when we speak about brain health, we are speaking about it in adulthood or older adulthood, but it is just as important for children as well. I do want to talk about the impacts to brain health and some important considerations. And then I want to spend the rest of the time talking about ways to optimize brain health, which is probably why you're here. So talking about what can you do, actionable things at a very high level or macro or global level, and then also talking about the individual level, meaning the individual child. And then we'll kind of sum up with some take home points and have time for questions at the end. So starting with our definition of brain health, you can see here what we mean by saying brain health is that we're talking about most likely how the brain functioning allows a person to realize their full potential. And this is defined by the World Health Organization, or WHO, as you can see here on the slide. So this means that if we're talking about how someone can be the best self that they can be, we have to go beyond the traditional disease, disorder, condition. And we have to think of everything that encompasses what is a person. So that's everything from how we think, how we take in information through our senses, our social emotional functioning, our behavioral functioning, and our physical and our motor domains. And so, in other words, we can think of brain health on a continuum. And the continuum is shown here, where you have well being on the left, and then all the way to disease or disorder on the right. And there's some components of brain health in kids that are important to highlight, exactly what I said before. So if we're thinking of this as a holistic kind of a conceptualization, we're looking at everything that a child does and everything that involves their world. So it should be thought of comprehensively and holistically, involving all of these areas, things like social, physical, and emotional functioning, as well as behavioral, educational, and thinking skills. Now, I want to talk about the brain specifically and the way it changes. And we've had two great talks that have really set the tone for this. But if you weren't here for those talks earlier in the week, that's okay. We're going to review it today. So as you can see here on the slide, the brain changes throughout our lifespan. And I think it's important to remember this, because sometimes we think of the brain as changing in early years of life and then kind of becoming static or less amenable to change as we get older, and that's not necessarily the case. And so as we talk about this, what you'll see here when we're talking about like our central nervous system, which is a fancy way of saying our brain and our spinal cord, you can think of those as our command centers for the brain, right? So these are things in which the organs or structures of the human body that control our conscious and our unconscious thoughts. So conscious being things that we're thinking of, and unconscious functions being things that we just naturally do as long as we're healthy, such as breathing. So this image shows how the brain changes across the lifespan, and what you can see is three different colors. So each stage or each color represents a different type of change or adaptation of the brain. And then you have the span, hopefully you can see my mouse, but on the left, you have perinatal period, and then the lifespan continuing all the way to the right with older age. So each brain adaptivity is with a color, as I said before. And I want to start with neuroplasticity, or plasticity, as a lot of people know it as. This is in the blue color. And so plasticity is the brain's ability to change and adapt. And as you can see, it's with us from the very beginning of life. This allows us to rapidly develop and change to support our functioning outside of the womb when we are born. As we progress through childhood, the brain starts to make a series of calculations, as I like to think of it. And these calculations aim to prioritize, preserve, and strengthen functions that are used most while we are doing what we're doing in life. And then it also kind of takes stock or inventory of the things that we're not using a lot or using the least and determined to not be essential for functioning in our day to day life or functioning in the environment that we're in. And this is known as pruning. So that's that yellow color here. And if you look at the yellow color displayed on the lifespan, you can see that through infancy and adolescence, but really childhood and adolescence is where that yellow color tends to really deepen or get dark because that's essentially where a lot of the pruning is happening. But again, there's color all through the lifespan, so this is something that is constantly happening. And as we age, the brain naturally experiences some level of cell loss, as Dr. Reed talked about last night. And this is depicted on the right with the pink color of neuronal loss. So you can see the darkest colors for neuronal loss are here, starting in adulthood and older age. But one thing that is a point that both Dr. Ray and Dr. Reed have already mentioned earlier this week is that neuroplasticity, this blue bar, goes across the lifespan. Now, yes, we're not as able to change and adapt our brain in our later years as we were compared to our younger years, but that doesn't mean that change doesn't happen. It can still happen all throughout our lifespan. So it's become increasingly important to think about things like this because what we realize is that what happens at our younger years or how we can really inform and influence and direct the way in which our brain is developing and changing, adapting, then that sets the tone for the adulthood or the later years in life. So over time, there's been more attention and discussion that's been directed to the importance of brain health at the individual level, but even in the societal or global level or global humanity context. And that's because we are learning so much about how we can influence these things like neuroplasticity, pruning, and neuronal loss. And that's why it's really exciting that the Society for Black Neuropsychology has really centered the brain awareness programming this week around this topic. So that kind of sets the tone or sets the stage for brain health. And now I want to shift our focus to brain health in kids. And I think somehow this quote is in the background and not in the front. Hopefully you can see it, but I'll read it just in case it looks the same way on your screen as it does on mine. Um, so this is a quote from the World Health Organization position paper on brain health. And the quote says, the brain's ability to grow and build strong neuronal connections, as well as adapt, repair, and or compensate over time in ways that allow us to sense, feel, think, move, and interact in the world around us is key to brain health. And I wanted to put that quote in our minds because I do think that it sums it up really well in terms of what we mean when we're talking about optimizing brain health. Um, and we can think of identifying ways that we can do that for the lives of the individual child, as well as for the family and the broader system that they are going to be centering themselves in. So now let's talk about what are some influences to brain health. And in this slide, you can see there's two sides or two main areas of influence. There's things that can directly impact the child, and there's things that can indirectly impact the child. And both are important. So if we're talking about the direct impact to the child, some examples, this is not all examples, but some can include things like disorders or conditions in which a child was born with. So this is predetermined before the child has even come into the world. Things like that can be congenital heart disease or sickle cell disease. Other things that can directly impact the child are neurodevelopmental disorders such as autism or ADHD. You can also have acute events. So just an example of that can be having a traumatic brain injury for an accidental trauma event. And then there can be chronic disorders or chronic medical conditions that happen over a longer span of time. An example of this can be epilepsy, where a child is having seizures that are reoccurring. All of these in the direct impacts can influence brain health because they can disrupt brain growth or they can impair brain function. And that's what we mean by having a direct impact to the child. Now, on the other side of the slide, you can see things that indirectly impact the child. So these are things like the type of the environment the child is being raised, the level of safety and security that's afforded to the child, social connectedness, health disparities, educational disparities. And again, this list is not any and everything, but this is just to give you a flavoring of what are some things that we mean by may not be directly happening to the child, but are instrumental in their world and thereby impacting them through indirect route. These indirect influences can also disrupt brain growth or impair brain function. So it's important to think of both as we think about brain health, particularly with brain health in kids. Now, on this slide taken from the World Health Organization, I encourage you, if you have time or if you have interest to learn more and delve a little bit deeper, their position paper is really fabulous. It's not just for kids. It's talking about brain health for all ages across the lifespan. And I think it's a really good read to think about how this concept is being looked at, researched, applied in terms of our everyday lives even in our medical care. But you can see here things like physical health, healthy environments, safety and security, access to quality services. So the figure really shows that this brain health is influenced by so many different factors that are not necessarily always in our direct control. Now, on this slide, I want to draw our attention to that control piece. So as we said before, some things aren't directly in our control, but there is an interplay of other factors that are influential to us and that we have to deal with, but that may not be something that we enact on ourselves. And considering that this is a presentation that's really centered in paying attention to Black communities, it's important to call out things like structural inequities stemming from institutional racism, ethnic and religious discrimination, systemic causes of oppression, and marginalization of any kind. And these determinants are very much interlinked, and they can be affected by these adversities that I named here. And again, this is not any and all adversities, but this is just to give you a good idea of what are some of the things that then work with the other determinants that you see in the figure to the left and will inform or help to shape brain health in kids. Um, One thing that I do want to say is that the importance of brain health in kids is that you're dealing with either optimizing potential or you're dealing with a loss of potential. And when we talk about children, we think of kids as having promise or having their whole lives ahead of them. Oftentimes you hear adults say, you know, you can be or you can do anything that you want to be or do. And I think that's great. But when we think about brain health and we think about some of these adversities that impact that, we start to realize that there can be some long-term consequences to development because there is a missed potential. And this not only impacts the child, but it can impact the child's family, obviously, but it can also impact the broader community where they live. Unfortunately, it's estimated that 43% of children who are under the age of 5 in low and middle income countries were at risk of not reaching their full potential due to extreme poverty and brain health stunting. And some of that is due to adversities that are listed on this slide. So it's really important for us to talk about these considerations here that I've listed as important considerations that go hand in hand with brain health at a broader level. So although we know what's beneficial for brain health, and we're going to talk about that, at an individual level, maybe even at a local level, a state level, regional, and a national, and even international level, the issue is that there's unequal access and distribution. And that's what creates these disparities. And unfortunately, as you can see on the slide, disparities are growing and they're not getting smaller. So we're kind of moving in the opposite direction that we would want. They've continued to grow over time. If we look at everything in terms of what is happening in the world and what is likely to happen in the future, there's a chance that disparities will continue to grow in the very near future as well. Um, and so there's a lot of kids who are touched by these adversities that create a barrier to optimal brain health. Most specifically, children who are in lower resource countries, children who are in lower resource settings within those countries, children who are considered ethnic cultural minorities with longstanding histories of discrimination, stigmatization, and exclusion. Okay. So I know that is a lot in terms of what to think about, but it's important because it does create a foundation and a background for some of the higher level, more macro or broader context level initiatives, laws, policies, and things that are being implemented to optimize brain health in kids. So I want to say that this slide, these are just a few examples of what is being done at this national and global level to promote optimal brain health in kids. And so thinking about the growing disparities, one of the things that a lot of countries are doing is really paying attention to family-friendly laws and policies that provide parents, caregivers with resources and time that's needed to invest in child development, right? So things like paid maternity and paternity leave. Um, People are lobbying effectively for 6 months paid breastfeeding breaks. People are also benefiting from things like tuition-free early childhood education, which we'll talk about more at the individual level. Other programs that provide for things at a more of a macro level are any initiative, program, policy, or law that increases access to nutrition for families who may be without or of lower income and or impoverished. There's also a lot of attention that's being paid to the elimination of environmental pollutants and toxins. Unfortunately, 99% of the world breathes polluted air to some degree. And we're in 2023, and that statistic is still pretty much true. Across the world, we still have chemicals of common use that are really known to be neurotoxic. So it's not even like, oh, maybe it's questionable. No, we know they are, but we still use them in everyday life. And so the impact of that on kids, meaning that they have access to these chemicals and may therefore ingest them in some way and introduce neurotoxins to their system, that's not great. Over 200 million people, including children, are exposed to toxins in their groundwater, things like lead and arsenic. And you can see here on the slide, I'm sure you all remember in the news, especially here in the United States, the attention that was paid to recently to lead exposure in kids. So these are initiatives that are being done so that way, as if you think of us as a national or global system, we're all kind of on the same team trying to support brain health in kids. Now, that may seem like, all right, that's a lot. So, what am I supposed to be doing? I don't like politics. I don't want to get involved in advocacy. And the answer is you don't have to. So now we're going to talk about like what we can do at the individual level with the kids who we know and love and see, and we hope to nourish their development and help them have optimal brain health. So we're going to spend the most time talking at this individual level because this is really where anyone can take action, right? So you don't have to be a specialist. You can just be someone who's interested in this, just someone who's connected to children in some way, and you just want to make a difference in a child's life that you know. As we talk about what we can do at the individual child level, it makes sense to consider how we kind of affect or change and optimize brain health starting in the early years. So we're going to start from birth to 5 because going back to the beginning of the talk, what we do in the early years sets the foundation or almost sets the groundwork for the type of brain health that we can experience across our lifespan. So The first thing that you can do in very young children is help parents, caregivers, or even yourself learn about what are the typical patterns of child development. And the Center for Disease Control, otherwise known as the CDC, has done amazing work in terms of making this free. Again, it's free, so I love free, and accessible widely to anyone, anywhere, at any time. And you can just go to the CDC website or you can Google CDC development. It comes right up. And they have things like printable handouts at each stage of development. So depicted here is an example of your baby at 4 months. And it goes from 2 months all the way to 5 years of age. And the really cool thing is on the front facing part of that kind of image, you'll see what are typical milestones in different areas like thinking and social and moving or motor. And the back side of that form is our tips and strategies that can be implemented immediately in the child's life to be able to enrich their development and optimize brain health. They also have this wonderful, again, free milestone tracker app. Most of us have some kind of device, and this can be used on that. And so it's on the go. We're so busy as a nation, and this is something that you can keep track of while you are going through life. So that way, you can encourage either yourself as a parent or anyone to have accurate reporting when they're doing things like going to a medical care visit with a pediatrician, or if they're speaking to a medical specialist, if they're talking to an early interventionist, the school, whoever it may be that is invested in learning more about that child's development. This is so important because the earlier we know that a child is not on track, the earlier there can be concerns identified, the earlier we can hook that child up with early intervention. And anyone who has worked with children and has heard about early intervention knows the earlier we intervene, the better. And so that kind of sets the tone for us talking about early intervention as the next thing that we can do at the individual level. So what is early intervention, right? Is it just intervention that happens early during the day? Not really. It's any kind of intervention that is starting early, meaning early in the lifespan. So these are services or supports that are happening from birth to 3 years of age. If there is a concern for developmental delay, then you are going to go ahead and do these early interventions. So this can be anything from therapies, physical, occupational, speech, language, feeding. You can have a developmental specialist or early interventionist. They focus on behavioral support and enriching the environment and activities in young life. I just realized that I think my battery is going to die, even though my computer is plugged in. So I'm just going to go plug this in really quickly. So sorry. Okay. Hopefully that helps. Sorry about that. Programs in every state and territory of the US have these early intervention programs, and it really helps a child to overcome the challenges, learn new skills, and improve developmental outcomes. And that's why it's so important to be able to optimize brain health in kids. The other thing that's also important is access to quality education for all kids. So if we think about what I had said earlier about tuition-free early childhood education centers, one of the biggest programs that has been very effective is the Head Start program. This is federally funded. It supports children from birth to 5 years of age. And their services can focus on helping to place a child in the right academic setting and helping to stimulate educational enrichment. But they do so much more. And so they have this focus on health and wellness, which is really optimizing physical activity, nutrition, oral health, things like screening for vision and hearing, building resilience. All of these things are very important for brain health in kids. And we have a program that really helps to work for that. The other thing that I really love about this is that they focus on the family or the caregiving unit and the well-being, which we know if the caregiving unit or family is doing well, then that goes a long way to help optimize brain health and
Okay, looks like we lost Dr. Butt for a quick second. Um, and I think there may be some issues either with um, the internet or the charger issue. So let's just take a quick second, and we will try to bring you the rest of her exciting talk. So just bear with us for a quick second. Okay, we're going to take a brief second here. I think that there are some technical difficulties going on with Dr. Butt's computer logistics issues, but we wanted to just take a moment to say thank you, everyone who has been streaming and who's been live. We really appreciate you spending your time and your evening with us to learn a lot about prenatal and child brain health, which is absolutely an important topic. We think about the brain health issues and the issues related to Alzheimer's disease and things like that. And we focus so much on older adults, but where do those things start, right? Where does our older adults start? They start as children and they start um, accumulating all of these things that impact brain health at a very early age. And so the talk that Dr. Butt is presenting has been very timely, very important, and very integral to just our understanding of what's going on as the brain ages, as people get older, particularly for Black and Brown communities where we need that education around those topics. If there are any questions or comments while we take this time, we would love to be able to answer them. I'll try to answer them to the best of my ability. She's the board certified pediatric neuropsychologist, so I will hopefully get some good feedback from her, but I will be happy to take any questions or comments or thoughts that people would like to share with us as we wait for her to return to the live stream. So any thoughts or questions, comments that people want to write into the chat. If you are first now, like this is your first time coming across the Society for Black Neuropsychology, and you're interested in some of the initiatives and the things that we do, we would be extremely happy for you to join the organization. We have so many initiatives and so many things related to neuropsychology for students, trainees, and professionals, and also for the community as well. So if you are interested, please join. The membership fees are very small. And we also have some waivers and things like that. So we're always looking for new membership, for new people to get involved. If you're interested in a career in psychology and even neuropsychology, we absolutely want your presence. We also want allyship. Questions that we often get is this organization for only for people who identify as Black or African American or things? And it's the short answer is no. This organization is open to any membership, to anyone, regardless of race, ethnicity, background. There is so much allyship and so much support needed to do the work related to neuropsychology for Black and Brown individuals. So if you are interested, absolutely, we want you to join. We want your participation. We want your input, your commitment to the work that we do. And so we're just so happy to have all of you here who are looking and joining us. I see Dr. Butt is back in the backstage, and so I'll give her a minute to get her slides ready, and we'll continue on with her amazing talk.
Okay, hopefully you all can hear me again. I apologize. Everyone who knows me knows technology is not my thing. It's not a friend of mine. I'm just in a world that uses it, and so I try to manage as best I can. And then it always seems to have a way to kind of keep me on my toes. So I appreciate your patience. Thank you, Dr. McBride, for pitching in when I got kicked out. But to thank you for your staying with me, because I do want to finish talking about this very important topic about brain health in kids. Um, so I hope that you were able to hear everything I was saying before about the Head Start program. I think where I got booted off was when I was speaking about their attention to the family slash caregiver support system village and the well-being. And some other important notes that I want to add before we move forward is the importance or the focus on the father and male caregiver engagement. I think this is something that has grown in terms of not only the attention, but the importance of this. And it is so critical to optimizing brain health in kids. And I love that they have initiatives that are done in order to be able to pay homage to that and also help with creating more space for fathers and male caregivers of all kinds. The other thing that I think is really important is empowering parents to be advocates. And this means advocates in every sense of the word. So arming yourself with knowledge, arming yourself with the confidence to speak up when things don't seem to be in line with what you feel it should be or don't seem to be in line with what you're seeing all the time. And also advocating for your child to be able to get the adequate care that they need. In the talk yesterday, we were talking about the advocacy of older adults, but advocacy in children is so important as well. And as kids get older, we can help inform them on how to be advocates for themselves. But in the younger years, it's really up to us as support people to be advocates for them. Now, in terms of some other actionable things that we can do for everyday optimizing brain health in kids is nutrition and activity, physical activity specifically. And this does not mean that kids have to have some sort of like regimented workout program. This just means moving. So it's so important for brain health of all individuals to be moving and eating healthy. And so that's why I think it's really essential to highlight these key things here. What's super important is we know about healthy eating, but I think we're learning even more, right? Because that can go a long way. So there's healthy eating, which has a lot of variables that go into the access to healthy foods and being able to provide that. But there's some interesting research where they looked at being able to give kids this food-based micronutrient intervention. And so what they did was they took multiple supplements like zinc, iron, choline, folate, B12. So these are, think of them as supplements that are really essential for brain functioning. And they gave them to children from undernourished or impoverished backgrounds. And they were preschool age children, and they showed that they could improve the cognitive abilities of these children by just giving them more nutrient rich food that we know is important for brain health. They've also shown that adding the consumption of the right kinds of fish can really go a long way to support brain health in kids. And so these are things that anyone can do in everyday life. The other thing that we really have to talk about when we're talking about brain health in kids is sleep. So sleep is so important for brain health at all ages, again, but it really is for children. Most people think that when you're a kid, you're dreaming, right? And so, or you're resting when you're sleeping. But that's only part of the story. So even though their body may be still, that brain is active and it's doing work to make sense of the day, everything that they saw, everything they were exposed to. It's especially important for consolidation. What that means is it's a way of putting together, synthesizing, and storing. So filing away information that has been exposed to and learned all through the day. So this means that when a kid is asleep, their brain is working to really kind of pull together everything that they learned from that day. And if a kid is in school, they're learning a lot and they're learning a lot just in their general environment and looking around. So sleep is essential for our brains because it maintains our optimal regulation of our attention, emotions, and behavior. On the slide, you can see the National Sleep Foundation has sleep duration recommendations. And I wanted to include this because I think sometimes we don't realize just how much sleep our children need, especially in the younger years. Children need upwards of 10 hours of sleep in order to be optimal and in order to have great brain health. We do need less sleep as we age, but you can see that even still in childhood, you're still talking about a lot of sleep. And so when we're thinking about how do we organize the schedule of the day and how do we balance things like social connectedness, academics, activity, it can be hard because we only have a certain amount of time during the day and we have to fit it all in. But we don't want to skimp on sleep. And that's kind of the thing that I want to highlight. And if any of you have worked in schools, been in schools, know an educator, there's always a story about a child who had an off day, who really was not acting like they normally would. And it's probably because they just did not have adequate sleep the night before. So the other ways that you can optimize brain health in kids is through these pictures here. So I included pictures of kids doing all kinds of activities that just allow a kid to be a kid. So things like reading, talking to them, playing games with them, all kinds of games, reading all sorts of books with them, talking to them not only about teaching them things that they're trying to learn, but just having conversations with kids. Some of the best conversations I've ever had are with really young kids. Like I had a conversation with a 3-year-old earlier today that was hilarious. Also, allowing kids to play with other kids. And so, if we think about what optimizes brain health in kids, it's allowing them to be able to grow and mature in all of the different areas that we talked about before: social, emotional, thinking skills, connectedness, behavioral, and just letting a kid be a kid allows them to do that. Now, before we get to the end, I do think we have to talk about screen time. So I don't think we can talk about brain health without talking about screen time. And there's a lot of information out there. Anyone that you speak to has some kind of opinion or information they know about or knowledge that they want to share about screen time. And what I find is there's opposite ends of the spectrum. So this slide has pictures that depict kind of every part of the spectrum. So the one end where people are saying never ever, no screen time, period, is bad. We're not going to do it at all. And then you have the other end of the spectrum that's saying like a kid should just be able to do what they want to do as long as they're happy and they're not screaming and tantruming. Then let them have the screen time. What does it matter? And knowing that the full range of guidance is crucial because it helps us understand where that guidance is coming from. And what I really have found is that when guidance is coming from the polar ends, it tends to be more opinion informed or opinion based. than it is based in scientific study or research. And so all that is to say that when reviewing all of the known studies and known research, what we find is that we need to meet somewhere in the middle. And on this slide, screen food in the middle talks about this healthy eating pyramid, with eating being the screen time, right? So a healthy use of screen time. And we know that there can be plenty of uses of technical devices that are beneficial to kids. And so you can see here that sometimes screen time can help with improve coordination. It can help improve language skills. It can help improve social connectedness. And then there's some types of screen time that are just purely entertaining. And that's not necessarily harmful. We all need entertainment. We all do it. So you really want to balance. And that's why kind of maintaining this in the middle stance and thinking about it like we would things like nutrition, where we're not eliminating any kind of food, we're just thinking of a balanced approach. I think we can do the same thing for screen time in order to optimize our brain health in kids. So the takeaways, other than make sure that your computer is always hooked into a power source that is actually emitting power, but takeaways for optimizing brain health in kids are to be active, eat well, sleep well, engage with your children, make sure that you're monitoring their development all throughout their lifespan, use supports that are available, and if you're not sure what's available, then you can connect with others to help you find those supports, and seek help when you're concerned, and seek help sooner rather than later. Okay. And now we will take any questions that were in the chat, and hopefully people are still on so they're able to hear our discussion and our answers.
All righty. Thank you, Dr. Butt. That was an excellent talk. And yes, technical difficulties, they get the better of us sometimes, and we work through them. And so we're happy that we were able to deliver a full talk. And I think it was timely. And I greatly appreciate your time. While we wait for maybe some questions to come through in the chat, I actually had one that I was just trying to think of some. You had mentioned about advocacy for parents, and I think that's so important, particularly for Black and Brown parents with their children, given some of the research that talk, issues with children, Black and Brown children going through school systems. What are some simple ways that parents should always kind of know what to be ready to advocate for, or kind of be on guard when it comes to their child, to like know to ask questions, or get another second opinion, if that makes sense?
Yeah, that does. That's a really good question. And I think one of the main things that you can do is really don't be afraid to ask a lot of follow-up questions. So for example, if we use a teacher or an educator is coming to you with concerns about maybe a child is not engaging socially with peers, or the concern is maybe a child is out of their seat too often, or distracted and not paying attention. Instead of just hearing that and then kind of taking it as it is, parents can advocate by asking follow-up questions. And these don't have to be challenging, and these don't have to come from a place of not my child, but it's really follow-up questions to get more information so that you have a better sense for going forward. So whether that be if there is truly a concern after you discuss it, moving forward with seeking help. So going to the right entities or the right institutions or the right providers. So if we go back to that social kind of example, right? So a teacher's like, yeah, I have a concern. We're in the preschool setting, and I always use Little Johnny as an acronym, so this is not speaking to any Johnny in particular. But Little Johnny is, every time we go on a playground, he's super excited about it. He gets out there, but then he doesn't play with any of the kids, and then he's right by my side the entire time. And we encourage him. We're like, no, Johnny, go. They're playing tag, or they're doing this. We try to get him involved in the activities, and he comes back to my side, and he's not really engaged. So if I'm a parent, I'm an advocate, I would say, okay, when he goes up to the other children, what is the children's reactions? Is it that he's trying to join and then he's not allowed? What are the sizes of the other children? Is this child, for example, extremely smaller than other kids in their grade? Maybe just because they have a short family, or maybe because they have a genetic condition like dwarfism or a skeletal dysplasia, right? So, is there actual reasons why there's a disconnect in the child's ability to socialize that can be fixed? Or is it that once little Johnny goes up, he doesn't know what to do? And so is it that he runs up with full gusto and then he just kind of stands there and stares at the other kids? So then it's kind of like, okay, so maybe we need to give him some tools of like, once you get up to the kids, maybe you say hi. What are you playing? And having that discussion with with the teacher about the other children and what's really going on in the context can help a parent be an advocate. Now, sometimes when you first do it, the teacher, or if it's another person that they're involved with, or even a doctor, they may say, I don't know. And then you can say, okay, well, let's pay attention, right? So I'll pay attention when I see them at the park or the mall or the zoo. You pay attention when you see them at school. And then like in a couple of weeks, we're going to come back and then we're going to see if we can answer these questions.
Yeah. And so it sounds like to provide a summary as well. I appreciate your answer. It sounds like let's do some more investigating before we make a conclusion about anything,
Right.
and cross all of our T's and dot our I's.
Yeah. Yeah. And I mean, I think, especially for our Black and Brown communities, an example will be things like ADHD, for example. There can be a stigmatization with that. And what I mean by that is not just hearing the diagnosis of ADHD child and feeling some kind of way about it, but I also mean looking at a behavior and calling it different things. So one child may have the same energy level and be called precocious or curious or just investigating, and all these great words that really show like, wow, this kid is really bright and they're exploring their environment and they're acting, and it's fantastic. And then another child can do the same exact behavior, but it's called hyperactive, it's called disruptive, it's called aggressive. And so we have this negative connotation sometimes that gets attributed to the same behaviors, but unfortunately, it happens in our Black and Brown communities. And so that's another way that a parent can be an advocate by further investigating. Mm-hmm. Not always saying that's the case, but being informed and knowing that we want to rule that out.
Yeah. And knowing that those biases are potentially there, and to safeguard, this is my child, and I'm going to advocate that, hey, you all need to be mindful of your biases potentially.
Right. Exactly.
That's amazing. I appreciate that. We have a question from Dr. Desiree Bird. She asks, how do you address questions about brain integrity from parents of children with newly diagnosed learning disabilities?
That is a really great question. And like a true psychologist, I'll say it depends. But in all seriousness, it really does. It depends on what the context of the evaluation is. And when I say the context of the evaluation, learning challenges is one thing, but who is that child? Who is that family? What's their support system? When we were talking about like more broader determinants of brain health, where is that child situated in life? When people talk about the integrity of their child's mind, or like some people will term it their capacity, you have to factor in everything from familial heritability, genetics, experience, exposure, enrichment, and that individual child's day to day. So it's a complex answer that I tailor to each and every child based on all of the information that I know.
And thank you, Dr. Button. And one more question. I have a follow-up one, and I don't see any more coming through. In my training, I did predominantly older adults neurodegenerative issues. And just from my just kind of anecdotal observation, I noticed that Black and Brown families were typically more unprepared for Alzheimer's disease diagnoses, meaning like affairs weren't together, family wasn't ready to take on more roles in terms of helping care for whether it be a spouse or a parent or a brother or whatever. And I'm wondering, in your work, since you work with children, do you see certain types of issues that come up with Black and Brown families that seem to be more troubling for the families, like a diagnosis or an issue that causes more trouble or Black and Brown people are not ready for?
I think stigmatization of classification or diagnosing in general is something that some of our Black and Brown families aren't ready for. And so that can be anything from you have a specific learning challenge in an area of math to you have autism or you have intellectual disability. For the reasons that we were speaking about earlier. Um, but one thing that I will say in the broader context of kids generally, I think a lot of parents aren't ready no matter who they are or where they come from. And so I very frequently encounter families that, even if they, in their narrative, so their explanation and talking to me at the beginning of us meeting, literally describe a disorder or a condition, when I reflect back to them what they're describing, what I'm seeing, what we find on testing, and how it matches, and now I'm just giving them a name or a term to sum it up, still be blindsided. And so I think that when we're dealing with children, the context of we want the best for our children, our hope for our children, there is something to be said about what is that parent's viewpoint in terms of when they kind of think to themselves from the very beginning, when they first held or first saw that child, gave that child a name, they had a vision for that child, what they thought or what they hoped or dreamt or, really wished their child would accomplish or achieve. And it might not be like this kid is going to be, an Olympic gold medalist. It might be a vision of success that looks like this. And then if somebody is saying that there are challenges or difficulties that kind of interfere with in their mind at the time of hearing it, that it could interfere with that vision, I think you get met with being blindsided. And a lot of times it's us talking them through saying that most of the time what we're talking about doesn't necessarily take that vision off the table. Maybe we need to adjust it, maybe we need to account for it, but you can still have some of the same things that you envisioned, hoped, dreamed for your child, even with a better understanding of your child's strengths and weaknesses, and moving forward to provide the best support.
Thank you so much, Dr. Butt, for that thoughtful answer and this presentation. I've learned a lot. Kids are not my forte, and so I try to stay as far away from them, except for my 2-year-old daughter, who can't get enough of me. But we absolutely appreciate your time, this wonderful presentation, and we just want to thank you so much.
Thank you for having me.
All right. And so we thank you all for your time and coming. Tomorrow we have another talk that we will be finishing up. We'll have Dr. Jeremy Grant, who is going to be presenting on midlife brain health. And so, again, this is Brain Health Awareness or Brain Awareness Week. We're so excited to have brought you Dr. Sakina Butt today. Look for a recording of this video on the YouTube website. The YouTube page for So Black Neuro, on the Facebook page. If you are not a member and you're interested in getting involved in the Society for Black Neuropsychology, please join. Our website is www.soblackneuro.org. Again, www.soblackneuro.org. And so we're happy that you joined us tonight, and we look forward to seeing you tomorrow. Bye-bye.